While thousands come and go from clinics and pharmacies to get their COVID vaccine every day, there are some who aren't able because they can't leave their home. As a result, they've been forced to wait and left behind.
I want to die. I want to leave.
86 years old, homebound with a heart condition and dementia, and yet Katina Sirachi's daughter Laura can't get her a COVID vaccine.
The agency called us and told us that they would put my mom on a waiting list and that she would be notified within 2 to 4 weeks. This is way back in February.
A pilot project was launched by Toronto Paramedic Services in collaboration with other healthcare providers on March 10th to provide in-home vaccinations to approximately 6,000 people in need. Similar programs have been established in other regions in the GTA. Laura has followed up with the province, paramedics, and is now being told her mama is not considered high priority because she doesn't live in a hot spot or have any other conditions.
Mark, I called again the agency and they said they have no news. Just Monday, I phoned the 1-800 number for to get my mom vaccinated because I'm frustrated. It came to a point where, you know what, I'm going to try and put my mom in there, and they said that she still doesn't qualify.
Others like her have said the same thing, fearing that loved ones will die before they get the shot.
I don't want to lose my dad now, and I don't want to lose him to COVID because this is something that's preventable.
At this point, there are still approximately 3,500 people waiting for in-home vaccinations in Toronto. Katina, meanwhile, has multiple personal support workers coming in and out of her home regularly to care for her. Why is this woman and others like her at home not getting their shot at this point?
Those eligible homebound residents are compiled into groupings. They are prioritized based on high risk and high risk communities and such, and then of course mobile homebound teams are deployed. It is a considerable work that has been undertaken. It is work that is priority for us.
The intent is to get to everybody in as timely a fashion as is possible, recognizing that there are some logistics issues involved that may make some people unfortunately have to wait a little bit longer.
A plea from one of the city's most vulnerable, waiting for weeks already.
I want to leave. Please, bring the vaccine.
My hope is to get my mom to get vaccinated as soon as possible. I lost my dad recently, and I'm not prepared to lose my mom to COVID-19.
At this point, Toronto paramedics are administering less than 300 vaccines to homebound patients per week. Based on the numbers still left on the list, that means it could be up to 3 months before everyone gets their shot. Mark McAllister, City News.